Greg O'Donoghue, and I'm Vice President for Welfare at the Union of Youth in Ireland. First of all, I'd like to thank the
I'm delighted that you were all here publicly, the role that you all play, and I suppose that role and how central it is to higher education. And part of that reimagining has got to be much more holistic and integrated provision of service, be that education service, be that health service, be that support service, in terms of what we offer, how we offer, and who we offer to. And I think that's quite a challenge for us all, because traditionally, I think we have a tendency to look at different sectors.
So my name is Martin Dabber, and I'm a PhD student at the University College Cork looking at alcohol consumption among third level students, and we're here today to talk about the REACT project, which is looking to respond to excessive alcohol consumption in third level.
Hi, my name is Dave Carey. I'm here from the REACT project based at UCC. Essentially we're looking at trying to respond to excessive alcohol consumption in third level students, and we want to come here to the Student Health Association to inform them around the project, receive their endorsement, and hopefully get their engagement and implementation in future.
Hi, my name is Jenny Brannigan. I'm a chartered physiotherapist. I am here to talk about contact injuries and their management, and including concussion, which is particularly relevant at the moment. It's a big problem that we see. I work with the FAI, with the women's national team, and we have to be very aware of it because a lot of times they go under the radar. So we're going to talk about concussion and the return to play protocols and what people need to be aware of.
So second impact syndrome then is the huge problem. So we've already discussed ours there, the goalkeeper in the orange on the ground. That's George North there. Second impact syndrome is the big potential problem. And basically, if you get a hit on the head and then you get a subsequent hit when your brain has not recovered from that first hit, that's where the catastrophic problem would lie. So you get a change in blood vessels, the autoregulation of the blood supply in the brain, you get an increase in blood flow to the area, you get increased intracranial pressure, which will cause a brainstem failure. And that happened to that poor young fella, age 14, up the north in schoolboy rugby. So when we're worried about what we see on TV, you have to be even more worried about what you have going on in parish fields, what you have going on where there's no medical person on the sideline. And again, it's awareness, it's education, it's to try and get that message out there that it is okay to be concussed and come off. If you're concussed, you must come off. You do not want to be hiding this because it's potentially catastrophic.
Hi, Graham Fry. Thank you for the opportunity to come and talk. It's great to be here and just to be able to experience some of the different situations that face the student health. People who are dealing with all sorts of different issues. Obviously my area is travel medicine. Fly off, you'd be in the middle of dark Africa within hours, literally within hours. And that's all happened over the last 50 to 70 years, 100 years. The big problem is that they can come home just as quickly. And they can home well within the incubation period for a lot of the problems that we're not used to facing. Ebola was a very good example of that, where in the past, over the last 10, 15, 20, 30 years, when you were sitting there and a patient came in and they weren't too well, you'd sit there and you'd chat to them. Now, over the last, 6 months, someone comes in and says, I'm just back from West Africa, I'm not too well. obviously because of this school, but a number of students who are going to harm motorbikes overseas, they've never driven a motorbike here in their whole lives. They're going to drive in the middle of Bangkok.
So what I've been talking about today are two cognitive tools that are quite quick and bright and breezy, they're not analytical. And the idea of the tools is that it gives people a successful intervention. That if we teach somebody something useful and practical, that's not too deep or scary, that first intervention can then encourage people to come back. And the principle behind all these tools is that we have the power and the choice of how we feel, so that we've got a little bit more sense of control. Because I think in a new environment sometimes, if you're a new student somewhere in a new area with a new subject and new responsibilities, you're away from home, I think it's that sense of lack of control. So if we can give people a sense of control again, just of their own thoughts, I think that's the most powerful gift that we can help them find.
We're going to look at what we can do, but there's an awful lot of glib stuff out there, these self-help books and self-help courses that tell you what you can do, but it's that how you do it that's much more important. Because everyone, we all do it sometimes when we're sick or listening to a friend, and we say, oh well, cheer up, or just let go, or take it easy, which is a very easy thing to say, but exactly how do you do that? So I'm going to give you two tools today that are really, really useful for yourself and for determining how you feel, what happened, did something bad happen, did something good happen, because there are so many things it seems that can precipitate the way we feel. So, for example, it might be, the kids phoning you up and saying something nice, or sending you a little picture on your phone, or forgetting to phone you up, and you might feel a bit sad about that, or being away from the kids and waking up in blissful silence. It could be any of those things that change your day.
Incoming President of the Association, just at the end of the conference now, and relieved. We're very pleased with how it's gone. It seems to have been well received. We have a great number of attendees, wonderful speakers, and hopefully the conference will kind of encourage people to continue to remain engaged with and engage with the association going forward, and hopefully we can strive to improve the association, its strength, its publicity, and also that we can improve just the services that we provide to students, both for the students' sake and also for the staff who are working within the different health units across the country. And delighted also with the collaboration that we have established and will hopefully continue with the USI into the future.